was really to try and identify stakeholders' data needs, and with the view that this piece of work would develop some sort of a methodology that could be replicated to different sectors in different countries. So we decided that we would focus on the Ethiopian dairy sector as a case study. The work is now finished, and we've got some nice outcomes from that piece of work. I think there's some things that we would need to consider going forward, whether there's a need for prioritization of data needs, as we've got limited resources, and the countries have limited resources to spend on improving data. And then maybe also, are there certain groups that need data more than others, and where should efforts be focused? The current status, so we had an initial pilot study, and we're just waiting on the final report. We've already reviewed the draft report, the working group. Current issues, really we can't support all stakeholders. Through our discussion, we kind of had a bit of a discussion around, well, where should you invest to get essentially the biggest bang for your buck? We also sort of discussed the need for perhaps a holistic approach. By promoting the dairy sector, what are the unintended consequences if we increase the dairy sector, for example? We discussed some other initiatives that are out there, such as the Livestock Master Plan. We had Steve Stahl at the table, and maybe is there an opportunity to do evaluations and support that ongoing piece of work, rather than maybe a parallel exercise with the demand study. There's also FAO's ASL 2050, which is sort of taking a more long-term view of, it's looking at kind of the modelling of how the populations change, environmental changes, and so on. So it's a much more holistic approach, which I think we probably really should take if we were to progress this. And the question was really, where do we fit in at this stage? So regarding next steps, I think we would need to really consider this carefully, and really, where do we fit in with the other initiatives that are ongoing, and do we at the minute, because we don't want to replicate efforts. So possible areas that we could contribute to, it was identified that there's a lack of adequate data on economic returns, and this is limiting the creation of, for example, a dairy board. But is this really what we're wanting to do? Do we want to do a deep dive in Ethiopia and continue on? There's already an initiative, as Hannah said yesterday, that the Gates Foundation has taken forward, and the information that we've collected will feed into that. We also considered whether there's a streamlined set of data that is needed for decision making, but we really didn't get down to, what that sort of set of data is that we need. So I think at this stage we need to sort of reflect on where we've got to with the demand study and consider whether it's worth progressing this further at this stage. So that's all I've got. Just leave that there.
Any comments? There's a couple. There's a lot. Only.
Thanks, Alan. It's a question, actually. So what are the next steps in terms of the working group activity? Or haven't we decided that yet?
I think we will not. I think the suggestion is not to progress with this at the minute. I think there'll be other potential working groups that emerge that have got a more clearer direction. So
Thanks. It's a question from something you put up, which is not necessarily specific to this, but it's when you put up biggest bang for our buck in relation to demand. I just wonder, I mean, since most of my time spent in public sector funding, which to me is a different set of metrics necessarily from a demand study. So it seems to me demand coming from a country might well be focused particularly on the economic side of things. And it's a more sort of rhetorical question about where LD4D sits in that is a sort of comparative advantage type of area of the biggest bang for our buck simply economic. And I don't think it is. But there's an interesting, if you go for demand, which I also agree is important, and there's an interesting philosophical discussion to be had that could come out with practical consequences.
So perhaps it wasn't the best terminology because it wasn't supposed to be related to economics. It was more where could we make the biggest impact if we were to put our eggs in one basket. If we were to, you know, should we try and influence the government and then there'd be a sort of a trickle down to the smallholder farmer, or should you try and support the smallholder farmer? I think there's so many different players that were identified. Where can we actually where should we try and make an impact?
You want to say anything more, Maggie, or no? Comes back to impact, yeah. Okay. Did you have something? Okay, this is last one.
My comment or my suggestion is not necessarily related to this session, but everybody by now knows that there are big projects, World Bank funded projects or livestock projects in Ethiopia, Tanzania, Nigeria, and other African countries. What will be, I mean, the influence of LD4D in the implementation and, you know, data generation in those projects? Because they are livestock projects, they are big projects, and I believe LD4D can influence and in the meantime benefit from that the data that will be generated in those projects. I don't know. I mean, where are we?
If you remember, we had a discussion about creating a data platform, a data portal, sorry, and there was a bit of pushback from the community because they didn't want us to have all the data. So instead, we created a data portal. So, you know, access to data is a bit of a hot potato. So I think it would be really good if we could access even the metadata or influence. I think there's a bit of unpack in there. What do we mean by influence access to these projects? We don't have a landscape of all the projects that are ongoing. I think it would be really useful if we did, or, you know, we put it forward as a task, because there's not a great deal of connectivity. And I'm sure you've all come across it as well, where you sort of happen upon a project and say, oh, right, so you're working here as well. Right, we're doing something very similar. We should come together. So I think that's one thing that we could, as a community, really make inroads to. And we've started doing that with the data portal. And I think we could extend that to other funders as well. Does that help, Fidelis?
Probably, I mean, Charlie, but let me, yeah, well, for example, the World Bank asked ILRI to lead the baseline data collection for the Ethiopia component of the project. And ILRI will involve probably in the monitoring and evaluation component of the project as well. And ILRI, no, the big livestock project. It's on, no.
Big World Bank project.
There is a big World Bank project. It's like in the range of 170 million. Yeah, anyone, yeah.
Shirley, do you want to? Yeah.
Thank you.
Yeah, we actually, before this big World Bank project got underway, one of the colleagues at the World Bank did a bit of a scoping on livestock projects in Ethiopia, and they got a very long list of very varied and many projects, but we could see if we could find that or get our hands on it as part of this as well. But as Tadele said, following on from the Livestock Master Plan, there is now a World Bank 170 million investment. I think there's several big private sector investments going on as well. So if there's an opportunity to coordinate across these somehow, it would be fantastic.
Yeah, okay. Hannah wanted to say something.
Thanks. I just wanted to add on to what Karen was saying. In our working group, we were discussing, the role of LD4D in this type of in the demand study work. So the study really went into in-depth, data types that are required by different stakeholders. And I think one question that was raised both when the working group was reviewing the draft report and then also in the discussion was, well, what do we do with that information, right? And so what I think that we had some discussions around if there was an opportunity to identify commonalities, if there are different, common data that are required by different stakeholders, but it really also wasn't clear as to what do we do with this information going forward. And I think that's one of the reasons why Karen is also recommending, that we pause on this to really reflect as well around what is the community's role in then addressing those data requirements that have been identified. So, and one thing that came out was that perhaps rather than working on, the understanding those specific data demands, is what are the demands around, the session that's coming up around standardization, standard classification schemes, metadata management, where there's actually a role to set forth standards that can then be used by other actors. So just wanted to share that as well.
Okay, Shannon.
I just wanted to sort of say one thing to tie up the discussions that Tadele and Shirley and that have sort of been hit off. And sort of Andy and I were talking last night about sort of the bigger picture of the SEBI grant, and to just sort of bring us back to Andy's initial comments about the impact of what LD4D is. And so as we're thinking about what the vision for what you guys want to make this, know that from the foundation's perspective, some of the things you're touching on, to be a platform to connect these data, these very big projects, that's what we're hoping for here. That was sort of the inception, that was the design. And so as you sort of contemplate and get to some of the nitty-gritty about what potential impact could be, that's exactly what we're looking for.
Okay, I think this is an important discussion, and it looks like it's an ongoing conversation. That there certainly is a demand for LD4D or something like LD4D to connect all these projects and provide some kind of service towards connecting the data. Can we move on? Kara.
Morning, everyone. Okay, I'm going to report back on the impact modeling working group that we had yesterday. So our challenge as a group was to model the productivity and associated net economic benefit changes to smallholder farmers as a result of an intervention. So the current status of this working group, so this was formed in Naivasha in February. We're working really with a team of modelers, economists, and we've got 2 grantees on board as pilots. So we've got GalvMed and Land O'Lakes Paid Project. I've put a list of names up there for, within this room, Roy, Neil, Di, Meredith, Mario, Carl, Kanar, and Andrew are all working on this working group. And that's not to mention all the others that are, also with ILRI, CSIRO. So in terms of the current status for GalvMed, this has progressed quite well. We've had several calls. There's been a face-to-face meeting held in Brisbane, a work plan drafted around what that impact model would look like, and there's been activities ongoing. For Land O'Lakes, we're probably a bit further behind. We've had a few calls so far. We need to generate that work plan and using a similar process as we've done for GalvMed. So if I take GalvMed first of all for the progress, so CSIRO and ILRI propose to use and expand a range of impact models. We have identified 2 case study locations. We've got dairy in Tanzania and poultry and Bihar in India. And just there, I've listed the activities that we plan to take place between 2018 and 2019. So 4 main activities: quantify disease impacts for important poultry and dairy health issues, evaluate the impacts of animal health interventions for different household types and production systems, evaluate the value chain consequences, and evaluate the regional, state or national consequences. So the current issues within the group. So this is a really complex issue. And I think yesterday within the group, the main feeling was we just need to stick to the plan, keep focused on what we want to deliver for the next 6 months, possibly even year, instead of getting caught up in where this could go. So I think that's quite keen. I mean, we really want this to be a pilot, and if this is successful, we can take that forward and discuss what the next steps would be to grow this beyond GalVmed, beyond Land O'Lakes. We need to consider the funding moving forward. SEBI, as LD4D Secretariat, does fund a lot of the working groups, but how is that going to continue? And I think that's something we need to speak about. GalVmed and Land O'Lakes, I mean, each model is very bespoke. The projects are very different. One's vaccines, one's AI. But the model structure to measure economic benefit is similar, even though their inputs can be very different. And we need to identify and coordinate synergies between the projects, so the modelers and economists, they're not doubling up on their efforts. We can use similar approaches. One thing that we're speaking to Meredith about is that AI interventions can take many years before you see an impact. And at the minute, modeling may be upstream rather than at the farm level, so it's more business modeling. So in terms of next steps, we really need to use this week to get together. So I think the plan is probably tonight just to sit down as another group, delve a bit more into the work plan for GalVmed, try and come up with a plan for Land O'Lakes that's similar in process, and really delve into these detailed work plans for the impact assessment and identify activities and revisit the timelines that we really have originally agreed. And I guess out with that is discuss the budget for this going forward and how far we can take it. So, I mean, well, if there's anybody else in the group that thinks we should add anything else, please jump in.
Okay. Jonathan.
Can I just ask what the denominator is with the productivity? Because I think that's quite an important issue with regards how we collect data. So if we're looking at economics, then can I be thinking about labour productivity? But if we're thinking about maybe environment, it could be about best use of feed. I think that's quite a critical issue when we start thinking about further data collection and analysis.
Okay, who wants to comment on that? Maybe.
Yeah, just to follow on that one, and perhaps, you know, also picking up Andy's point about impact of meetings like this. I mean, to me, one thing of turning theory into practice is when we use the word impact to always sort of categorize it into what impact we're measuring. So yesterday when I was talking about the specific versus the next versus the, you know, the different levels of impact, I think in terms of trying to get communication better amongst us, just also. So, you know, when Neil talked about it yesterday, it was talking about productivity, and that's what Jonathan then picked up on, but it's sort of always, it's perhaps having a sort of principle within this group that we don't just talk at that high level. So we talk about that impact in this context is that's what it's going to be, is productivity, and then Jonathan's point being, okay, productivity in what units?
And I think there's a lot of confusion, so we tend to use production and productivity interchangeably. Productivity requires a denominator, and we need to be quite specific about which denominators we're using in that context.
Just on behalf of the group, I think that the kind of modeling that we do is multidimensional enough to capture a range of denominators. And I think that that's a very important point, because it's not only productivity per animal a day or per look. Here we are dealing also with a range of feed resource use efficiencies. We are dealing with a range of additional products. We're dealing with labor productivities. The kind of modeling that we do, it's not just running an animal production model, but this is really full farm household analysis that will enable us also to track environmental efficiencies and others.
Andrew, yeah.
It's actually going back to the fundamental question of loss of production. That just there's so little data on that for the disease. That's a fundamental issue. I mean, if we can get mortality data, that's good. But then, as part of this working group, Roy has, through Paul, put together a database on a range of diseases and come up with some estimates, and we've got some there for mortality, but it's pretty light on in terms of production impacts. And while we ultimately want to go through the whole chain from production through to labour through to the economics, that if we can't overcome some of those fundamental blockages, then you do risk, you know, garbage in, garbage out.
Okay. I think we need to move on. Did he?
Yeah, I was in the group, and what came out is there are three components which are working independently. There's a model working on productivity of production. There was another model which was working on diseases, and one for AI. But you recognize the three elements coexist and they affect each other. So what we suggested is that the production, the AI, and the disease components need to work together, because the disease will affect the AI, the production will affect the AI, and even the disease. So, and a matter of productivity, as is been indicated, is many factors. So if you're doing AI, you must not look at the product of the offspring. There are many parameters that you'll have to capture that is related to productivity, conception rates, return to, yeah. So they should not work in isolation. Otherwise, I don't think we'll see many benefits in many years. But we can see the benefits within a year if both of them, or if the three of them, were to be coordinated together.
Okay, so I think that conversation is going on this evening. Is that right? Mario and GBAT.
Right. Okay, so I'll try to be quick. I have the benefit that Jonathan presented a very detailed exposition of what the project is trying to do before we broke into the groups. So just as a little recap, what are the challenges addressed by a project like GBAT? It's really very much about trying to improve disease prioritization. The discussion in the group was that sometimes when practitioners go to the field, they find themselves confronted with the reality that farmers are prioritizing different diseases than what the researchers tend to prioritize. So this will try to bring together much closer this disease prioritization, especially using the ability to use a bottom-up approach might enable us to do that. And hopefully the project will also lead to improved disease control, improved evidence on disease impacts, which will be important both for the public and the private sector, in order to improve the resource allocation. This is basically how much money are we going to spend on the different diseases, and perhaps these rankings change, perhaps whether it's for prevention or whether it's for treatment will also change. And definitely a project like this will guide the kind of data that we need to collect in the future. So that's basically a recap of what Jonathan said. The current status is that the project is at a planning phase with the idea of having finalized the project proposal by March or so, and then to try to submit it for funding. Progress so far, you said nobody has said no, in the sense that the project is receiving the blessings of the community. The project has been explained in a range of venues. Jonathan has already presented this at a meeting in Paris, at OIE, and in several other fora. And it seems to be gaining significant traction, both from the practitioners, the stakeholders, and the donors. So I think that's a great accomplishment. So issues to be addressed. At the moment, I think that the key thing is to try to finalize the partnership. How is this project going to be delivered? Because as Jonathan said, this is probably a large endeavor. It's 10 years, broken into probably 2 or 3 phases. So getting the partnerships right, and also the local engagement will be fundamental for this. Choosing countries, choosing the right diseases, etc. This needs the necessary consultation. The work program is at the moment being developed, and all the different working groups have been tasked with providing inputs by, I think it's by February or something like that. And then, well, there's the issue of, well, how much would this cost to really achieve some of the desired impacts. So in terms of next steps, we focused on what should be the linkage between the LD4D group and the GBAT group. And we found that, look, there's plenty of, basically, most of the people working in GBAT are also in LD4D and vice versa. There's many points of contact, but they are slightly different mandates. I think that the next step, as a next step, we really need to define better how we will interact and collaborate. Certainly the LD4D, with all the data collection and all the different practitioners and partners, would be very beneficial for a project like GBAT in terms of accessing particular data sources from projects and so on. So perhaps we need to think how to facilitate that in the most seamless way. We also discussed whether there was a need for a GBAT LD4D working group. I don't think that we finished with that discussion, but that is something that. Sorry, that's my phone. Can you please turn it off? Yeah. Yeah. Yes. So
that was me calling you, actually, Mario, to say it's time to finish. Yeah.
Right. Yeah. So whether we need the working group is still something for the next step.
Good. Thanks, Mario. Any comments? No. Okay. And the last working group is, Della wants to say something.
All questions will be answered by Jonathan.
All questions answered by Jonathan. And meanwhile, Tim, could you set up?
Jonathan, what will be the diseases of interest in this project? The diseases of interest. Which disease? I mean, which diseases will you be focusing on this study?
To begin with, probably the kind of top prioritized diseases globally. So FMD, PPR, rabies would be issues, African swine fever, classical swine fever. But we haven't yet fully defined that. But that will be an initial sweep in the first stage. The idea is that we would spread out across a bigger range of diseases, both endemic and notifiables, over the time period. So we'd end up with a long list of diseases, but not try to do everything at once.
Okay. One from Brian and then Tim.
The issue of prioritization, I'm part of the working group looking at prioritization. But what are are there any ideas about LD4D's contribution to that in terms of methodologies and approaches? Did anything like that emerge?
No.
Why not?
Because, Brian, you're going to talk at the end of... I mean, the thing for me with that prioritization group, which you're part of, is that when you get together, I think one of the important things is scoping about who we're prioritizing for. And the prioritization tools, I think, will start to become emergent as we sort of look at that list. And we're not looking at one client for the kinds of things we're generating, so it's going to be slightly different across the piece.
Okay, good. Tim, fire away.
Yeah, so we were building on the impact discussion yesterday morning. The first two questions didn't apply because there is no working group. So we dived straight into issues, and we had a fairly broad-ranging discussion around what the key issues are. And we felt that many initiatives actually lack assessment of impact. We do need to speed up the assessment of impact because there's a certain amount of urgency needed in development projects. Getting the partners right in terms of assessment of impact was deemed to be important. Using impact to check sustainability is also linked to having the right partners and to ensuring that you start thinking about policy and institutional aspects of ensuring effective impact at an early stage. So we had quite a discussion around all of that, and we sort of concluded that there were no clear principles. There was some experience around how to assess impact pathways using the continuum that Maggie described yesterday morning, from outputs to global impacts. There's experience, but nothing really, no guidelines that we could identify, although we did talk about the ISPC process and assessment of CG initiatives, where theories of change have been used, but again, what kind of theories of change? Everyone seems to have a different idea of what a theory of change is. I'm sure my idea is the best one, which is built on the FAO process of theory of change, but it's very different to what other people think. So how do we use those theories of change? How do we ensure that the assumptions in those theories of change are properly tested at an early stage right through the project, and lessons learned and fed back to the partners? We also noted that from the presentations yesterday morning that the donors themselves have different ways of thinking about impact, but the SDGs do seem to be globally accepted, and therefore could the indicators for the SDGs perhaps be better utilized in terms of looking at impact pathways. We weren't sure, but it was something that was discussed. In terms of next steps, we thought it would be a good idea to set up a working group on impact pathways, but we would do because we were all the people in that who were keen on this issue. So it'd be good to get some feedback from the community of practice people in the room on that idea. Who should be in it? Well, we felt that it would be useful for the funders to be in it. SEBI, of course, and then we identified GalvMed because for obvious reasons. Land O'Lakes, CSIRO are doing a lot of work with them, of course, so they're an obvious one. And Maggie, through her experience with ISPC and the CG system, has a lot of experience in this area. So her name appears there. Whether she's got the time is another matter. What would be the responsibilities of the working group? Again, assessing demand for guidance in this area. Is it just something that a few enthusiasts think that there's a demand for. Is there really demand for it? Possibly, this is quite ambitious, producing guidelines on best practice, engaging with other groups, perhaps in other sectors, on what they're doing, and then finally lobbying for change as necessary. Who do we lobby? Is it only the donor community, or is it others? What sort of resources would be needed? Facilitator, possibly some travel costs, possibly a survey. Otherwise, the use of virtual meetings wouldn't be too expensive.
Great. Okay. Sounds like there's the kind of germ of a new working group there. Any comments? Jim.
Thanks. I just wonder whether this group has a vast amount of experience in impact path. I mean, I think it's quite a big in impact pathways. I think it's quite a big topic that's covered vastly by other groups. I wonder what comparative advantage we might have in trying to provide guidance on that.
But is it something that's primarily for this group rather than beyond this group? So what level of demand is there?
Jonathan?
Mine's more of an observation from the meeting that Maggie convened with the IPC committee in Stellenbosch, that the SDGs are so complex that people tend to get involved in talking about them, then they become almost intractable about how we manage the process. Whereas the MDGs were quite clear. So I think the SDGs kind of muddy the water a little bit because it's so complex and people are looking at trade-offs all the time. I think there's a danger with the SDGs that we get lost in the detail and don't actually force anything better. So I think with that impact stuff, we have to be careful around that.
John? I just wonder sometimes if we obsess a little bit too much about measuring impact at like the strategic level. I mean, you mentioned, for example, we need to do something within 10 years, and maybe we need to do something within 10 years because within 10 years our strategic goals will have changed. So, today we might want to increase production. In 10 years we might want to reduce CO2 production. And I wonder, I think it's important to measure impact at the sort of project level of what you're trying to do. I just wonder if at the strategic level, if really it's so useful, even though it sort of makes sense. I just wonder about that.
Anyone want? Well, Maggie, you going to respond to that?
Yeah. To some extent, it's more up to funders to respond in terms of their degree of interest in it. I mean, to me, impact in agricultural research for development is so essential. I mean, otherwise, why are we doing it? Yeah, hoist by my own petard in that one. In terms of, to me, there's a couple of reasons for looking at impact. One is to change the mindset of researchers who try to produce. I mean, I'm quite involved in the GCRF, the UK government's Global Challenge Research Fund, which is £1 billion, and that is going to be assessed basically on impact. And so the Research Council's UK Research and Innovation currently have a team looking at how to assess that impact. My experience of GCRF is that UK researchers are not actually very good at understanding what. It's all right, I'll give you it back in a minute. Don't get quite so agitato over grabbing it. It's a sort of arm going out there is a bit intimidating in terms of looking straight at you. Stand up and talk more to us. Intimidation. Basically, if we're not about impact, what are we doing here?
Yeah. So especially when we talk about the research. So, for example, one of my little pet peeves here is we have a moment about the research funders in particular, sort of making a big thing about supporting neglected tropical diseases, for example. But the reason they're neglected is because the research funders neglected them in their strategies in the 80s and 90s. So, I mean, impact have changed. So, what's true today is not necessarily true in the past. Sort of thing.
go on this for hours, it's not a thing. I mean, to me, the one thing that is absolutely certain that's not going to change is that the global community, however many countries it is, has signed up to the SDGs. We may not like them, we may think they're too complicated, but frankly, we have, having been in Stellenbosch, as Jonathan said, we had a talk from one of the co-authors of the IPCC report on 1.5 degrees. We don't have 30 years to actually turn things into impact. So unless we accelerate our pathways to impact, I mean, it's not going to affect me. I'm going to be pushing up the daisies somewhere before climate change has a, but it is serious. And if a group of scientists, you know, isn't going to sort of say, we need to accelerate to impact, therefore we need to understand it, therefore we need to understand the context in terms of setting priorities, then I think the world's in a worse place than I think.
Is it on this one? Yeah, okay.
Yeah, I was just going to say that purely from a grantee level, you know, we trying to affect change or achieve impact in the field. I think this would be very beneficial. And so maybe if you just look at it from that sort of lower level, from a grantee and from a donor perspective, I think there's a lot of scope just to have it a little bit better specified as to how we should be measuring, what we should be going for, and some guidance on impact pathways. I think that would be very helpful.
Okay, so to summarize, I think that there's a lot of impetus around this impact area, and the question is where LD4D fits into that. And Brian had something?
I did. I just wonder where the comparative advantages of LD40 in such a huge area of impact. So what specifics? And I wondered whether possibly you considered issues relating to the standard set of headings under which evaluation takes place, as you well know, of things like relevance, effectiveness, efficiency, and sustainability, of looking at specific areas of activity and evaluating them under those headings might be slightly more useful, or there might be, put it this way, more of a comparative advantage of this group.
Okay, I think we're going to have to wind this conversation up, but there was one more. I think there was one more. Was it Hannah? Yeah.
Thanks. Just building, I think, on what Brian said and Tim said, I think it would be very helpful to get very specific on what is the question that's being addressed, especially if it's going to be taken up as a working group. So who is the audience? Like impact, as we know, is such a broad term. And I can see that being interpreted in many different ways. So impact when we're talking about grantees and looking at, you know, within that framework that we looked at yesterday of just funders and donor organizations versus looking at evidence gaps, you know, where are the evidence gaps, sort of as what you were just talking about, Maggie, and can we target research and specific impact evaluations to fill those evidence gaps for a very specific purpose. And that could also link to some of the work maybe Shirley's been doing on communications and messaging. So I would just say that I think it's an important topic, but being very clear on who the audience is and what the purpose is of something like this would be very helpful. And then that way the work can then be structured from there.
Okay, good. So we already have run a little bit over time, but these were important conversations. But we're going to move on.